As a practitioner, when I have a question, I do have lots of resources that are available to me. In my electronic health record, there are often information, things I can click on that may tell me about a drug. I've got Dr. Google that can tell me lots. I've got resources, journals, and other online textbooks that we frequently use. But doing all of this takes a ton of time. So in the middle of a busy practice, or for me as I'm taking care of patients on the inpatient wards, I don't have an hour to look stuff up. And often, even when I've looked things up, it's usually somebody's opinion, and it's hard to figure out whether I'm getting the straight story or not. So what I would really value is, in essence, an expert opinion. Somebody who said, okay, here's what's out there, and somebody who can articulate to me what that is. Here are all of these studies, here's what's good and here's what's bad. And if we distill them down, here's what we think, here's our recommendation, and can really back that up. And then go one step further and say, okay, here's how you should actually incorporate it into your practice. You know, there's a difference between what academic detailing does and, for example, the creation of guidelines. So there are tons of practice guidelines out there, and they're really central for practitioners. I use them all the time. But they really sort of say, we recommend this or we recommend that, and often in broad terms. They may recommend classes of medications. They may not talk to you about risks and benefits in the same context, or they're voluminous. So for example, for a single condition like atrial fibrillation, a common heart condition, the practice guideline is hundreds of pages long. Most doctors don't have time to read hundreds of pages, let alone it being a little bit intimidating. And so what we seek to do is take that information, take stuff that has happened after the guidelines have been published, stuff that's brand new and up to date, really distill it down. And so we distill it down into really 2 or 3 different formats. One of them is an evidence document, which is meant to be weighty. It's meant to be a synthesis, but it's written in a way that is much more readable than most scientific writing is done. Secondly, we have a brochure. In essence, what we call an unad, a way to communicate these complicated ideas in 8 or 10 or 12 pages, and which is a detailing aid for when the detailers meet with the physicians. And so we're really seeking to synthesize all of that data, make it practice relevant, and give clear recommendations, and to do so in a way that is much more approachable for the average practitioner.